Hello, welcome to kidshealthTV. Today on Parenting Medical Guide, we'll be discussing fever. Fever is one of the commonest childhood presentations. It's one of the commonest reasons why parents and caregivers come to the hospital to be seen by a healthcare professional. What is fever? Fever is abnormal elevation in body temperature and is taken as temperature above 37.5, especially when the peripheral temperature is the one being measured, which is what we do most often in the home care settings or child care settings outside the hospital setting. The instrument used to measure temperature is the thermometer, and this is a digital thermometer. This is a digital thermometer and it is very helpful. It's something that can be gotten in any community pharmacy close to you, and I would recommend that this is something every parent, every carer should have, and its use is very simple, very easy, very straightforward. This thermometer is to be put under the armpits of the child, and not as I'm doing now, it will be bare, right under the armpit, and the arms of the child will be clasped together such that the thermometer is held in place, and when it finishes reading, you will hear the sound it's making, and that sound will say it's just to indicate that the temperature has been read and the value is seen and action is taken on it. So any temperature greater than 37.5 is taken as fever, and this should be acted upon. What are the causes of fever? The causes of fever are inexhaustible. They are actually so much, but the interesting thing is that most often in our practice, we realize that many parents, many caregivers, they just assume, they just make assumptions as to what the cause of fever is, and they attempt to prefer several measures, which is one of the things that makes this health education necessary. I would be mentioning some causes of fever, but the take-home message is that when a child in your care has fever, please do not assume a cause. Once you've been able to accurately realize and measure that this is fever, please do take the child to a qualified health professional, a standard hospital where there is a nurse and a medical doctor that is trained to see children, that is trained to assess children, that is trained to identify danger signs, take appropriate measures, and refer if necessary. The causes of fever in the tropics include malaria, and other causes include respiratory tract infections, which is also very common. Every child is entitled to about 4 to 6 episodes in the year, actually, depending on the season, the environment, and other factors. And respiratory tract infections include tonsillitis, that is infection in the throat that may manifest as sore throat, and the child will have very high fever, high-grade fever. Also, other forms of respiratory tract infection like infection of the middle ear, which is called otitis media. Common cold also is something that can cause fever in extreme cases, especially when it's been caused by some form of viruses and is presenting in form of a flu. So the other causes of fever include urinary tract infection, and this is often missed. And the danger with urinary tract infection is that if it goes missed, undiagnosed, misdiagnosed, mistreated, it can actually scar the kidneys and actually cause the child permanent kidney damage, especially if it becomes recurrent. So if your child has fever, please seek professional help. Let the correct cause be identified and properly treated to prevent long-term complications. Other causes of fever include pneumonia, which is infection of the lung parenchyma, and of course there will be additional symptoms like cough, and there may even be difficulty with breathing. Other causes of fever include fever plus rash, which may be caused by various viruses, Roseola infantum, measles, varicella, which we call chicken pox. So again, not every fever plus rash is measles, as it is wrongly assumed by many caregivers, and they just say it's measles, and they begin to profile all sorts of home remedies. Please take that child to the hospital. Let the diagnosis be made by a trained health professional so that appropriate treatment can be given. What are the danger signs when a child has fever? If a child has fever and the child is inactive, irritable, refusing to play, refusing to eat, vomiting, and then the child becomes unresponsive, the child is shivering. If it's a baby, a younger infant, the diapers are dry, the frequency of wet nappies is reducing. That means urination is reducing in the child. It is time to run. An infant that is not sucking, if it's a child that is still being breastfed, refusing to feed, it is a danger sign. It may be a sign of a very serious infection. Other more serious causes of fever actually include sepsis, that is generalized bacterial infection in the body, generalized infection in the body, and it is actually very dangerous. Meningitis, that's infection of the covering of the brain. Encephalitis, infection of the brain itself, and all this will initially manifest as fever, and it may be difficult to differentiate one from the other, especially at the beginning of the illness. So let's, as parents, as caregivers, as people who have responsibility of taking care of children, please, let's do our due diligence. Have your thermometer. When a child is showing signs of being unwell, please objectively measure the temperature. Oftentimes parents come to us and they say, oh, I think the child has had fever for about 6 days. Did you measure the temperature? They say, no, I just felt the body was hot. So what did you do? Oh, I felt it will go. I was just giving paracetamol. Please, even paracetamol has a side effect, so it is not good enough that we just keep giving a medication based on our assumptions without objective evidence. So, as I said earlier, one of the home measures for fever, treating fever, immediate home measures that we can take at home is actually tepid sponging. And what is tepid sponging? Tepid sponging is using a tepid water. Tepid water, meaning warm water. Objectively speaking, tepid water is supposed to be water whose temperature is about 1 degree Celsius below the body temperature of the child you want to tepid sponge. But practically speaking, under the conditions when a child has fever and you actually need to tepid sponge, I know it will be tricky for a parent to take thermometer, measure temperature of water, measure temperature of this. So I will just say that to get the appropriate temperature for tepid sponging, just make it warm water, tepid water, not too hot and not cold water, because cold water is not going to do what we want. What we want to achieve is that by applying the warm water through a wet napkin on the body of the child, the evaporation takes place, and then a bit of cooling follows evaporation, and that brings down the body temperature of the child. Cold water is not going to achieve that, because cold water is going to cause some actions in the blood vessels of the child under the skin, which will worsen shivering, worsen a lot of reactions in the body, and it's not going to give us the result we want. So the water to use is actually tepid water, warm water. You dip a towel in the tepid water, and then you just dab it on the child of the body, not scrub the child of the body. You dab it on the child of the body, and then you leave it to dry off on its own. Tepid sponging. Also, depending on your location, it's may be helpful at times, especially if you are far from the health facility, or if it will take a while for you to transport your child to a health facility. It may be helpful to give paracetamol syrup, especially if there is a family history of children convulsing when they have fever below the age of 5 in your family, so as to prevent convulsion that will then make everybody run helter-skelter. It may be helpful to give paracetamol syrup. Paracetamol syrup is not treatment for the cause of fever. It's just a temporary measure to bring down the body temperature, so that if the child has tendency to convulse, the child will not convulse on you before getting help in a health facility. So you give a dose of paracetamol while making arrangements to transport the child to a health facility. So I've talked about tepid sponging, I've talked about the use of antipyretics, the commonest being paracetamol, and be easily gotten over the counter. The most important thing is to get that child to a health facility as soon as possible so that appropriate diagnosis will be made. Meaning, when the child gets to a health facility, questions are asked from the caregiver as to the presentation, the nature of fever, whether it's been there or whether it's been on and off. Because there are illnesses in which the fever will be on and off. So the fact that a child has fever in the morning and now the temperature is normal does not mean the child is well if you have not sought treatment. There are illnesses that will make that whose pattern of fever will actually be on and off. So the questions will be asked, the child will be properly examined, and the examination will include checking the eyes of the child for other complications such as pallor, checking the ears of the child to rule out ear infection, checking the throat of the child to rule out throat infection, checking the urine of the child if there has been anything in the history to suggest that there may be a urine infection. There may be need to do some blood tests. There may be need to do some imaging, x-rays, ultrasound if need be, especially if there is swelling of the joint or if the child is refusing to move a limb. So tests may be necessary to further arrive at the diagnosis. Some parents, they get impatient when trained medical personnel request for some investigations in order to arrive at a diagnosis. Because the practice of medicine now is evidence-based. You should be happy when a health professional is requesting for some form of further investigation, depending on the scenario. Sometimes from listening to you, from examining the child, oftentimes we can't make a diagnosis and we can provide appropriate treatment. But if a test is necessary, please allow your child to have it so that that child can have the best. And then the child is treated based on the exact underlying cause. And treatment may vary. It may be anti-malarials, it may be antibiotics, it may even include some other procedures depending on the cause of the fever. But other supportive measures to take, even in addition to tepid sponging, giving antipyretic if warranted, is that ensure that your child is properly hydrated. Enough fluids, enough water. Encourage the child to take enough fluids and enough water even before, during, and after treatment. All this will help fever. All this will also help the child to excrete whatever medications have been given appropriately, and it will help the overall well-being of the child. Fever is good because it's one of the body's ways of reacting to the foreign organism or the foreign body that is making the child unwell. It is one of the ways of announcing to everybody around that, oh, something is going wrong here, please take action. And we should make use of that natural system, alarm system that has been made with our body system, in that we should seek help on time in order to get the appropriate treatment for the child. So that will be all today. If you have any questions, please drop it in the comment section. I'll be very happy to attend to your questions. You can also reach us on the email address and on the number via WhatsApp or the number displayed in the description. If you like our videos, please do like and share our videos so that other parents and other caregivers will benefit from this guide and from this health education. If there are other topics of interest to you that you want us to address, you can make your suggestions in the comment section. I will be happy to hear from you. Until the next episode of Parenting Medical Guide, please stay safe. Let's keep all our children healthy. Thank you for joining me on today's episode. Bye.